Are you a runner experiencing severe knee pain while you run due to an IT band issue? Are you nervous that someone's going to tell you that you have to quit running in order to heal, or that you're going to have to take a bunch of medicine, you might need surgery, or that you're just not going to be able to perform that big race coming up on your schedule this season? I'm Dr. Alex Brown here at Boulder Sports Chiropractic, and if you follow in this video, I'm going to give you 3 tips to help with any type of IT band pain. Step number 1, we're going to talk about cadence. As runners, a big problem we see a lot is that people are actually overstriding. This means that they are not taking as many steps per minute as they should be, and this ultimately is leading to an inefficient running style. Numbers that I like to see is I always encourage people to get to around 170 steps per minute. More is always better. However, we have a tendency of seeing people with heel pain, knee pain, IT band pain. Their numbers are usually around 160 steps per minute, if not lower. So we always just want to try to bump that up a little bit here. One of my tips, if you don't have a fancy watch that tells you how many steps per minute you're taking, try to download a song that has a cadence or a beat of around 170 steps and see if you can match that and run along with that. Foam rolling is also a really important part to preventing the IT band pain from getting worse and helping to mitigate those symptoms. Now, when it comes to the IT band, we have 3 main muscles that contribute to the tension that you're feeling in the IT band and in the knee where it connects. We have TFL, glute med, and we have our glute max muscle. They all attach to the top of the IT band, which then continues to attach at the side of the knee here. Foam rolling here, you're mainly hitting just the quad, so we want to target these muscles up top here. We're going to do that by hopping on a foam roller. Now I'm going to rotate my body down just a little bit so I can hit that front TFL muscle. Now on this side, I'm going to demo where I'm hitting. You have the bone on the side, you have a bone in the front. I like to go pinky to thumb, and that little pocket, that's where I have that foam roller in right now. Now from here, I can roll up and down, or I can pin and stretch. So making contact with that muscle, I can go knee up, and then I can go knee back. So trying to get into some hip flexion, hip extension. I'm going to continue doing that as I just start to rotate my body so that my chest is starting to face forward, getting into a bit more of that glute med. And then I can also get into the glute max by rotating even further. This one I like to sit up a bit more, rolling back and forth, or we can even get into the figure 4 cross leg pattern. Step 3 is going to be activating our glutes, specifically glute max, a little bit of glute med. We're going to do that without any equipment today in a nice tall standing posture with some glute standing kickbacks. So from the front, we're going to have a slightly athletic stance, a little bit of a knee bend. Now I'm going to take my one leg and I'm not going to kick straight out or straight back, but rather a little bit on a 45-degree angle here. You can do this with the leg straight or a bent knee. Either option's fine, but ultimately we do want to feel it in this kind of back hip area. That's right where that glute med is located. So here, there shouldn't be a lot of wobble in the spine. Should be pretty strong. A little pump. I like to hold for a second just so I can kind of feel it, make sure I'm engaging that glute. From the side, that looks like this. Athletic stance here, kicking out. And back just like that. There shouldn't be a lot of spinal wiggle. We don't want to do that. We don't want to feel it in the back. Should be all in that hip. If you're still experiencing pain after these 3 take-home tips, come on in, book an appointment with us at Boulder Sports Chiropractic where we can take you through a personalized evaluation and treatment plan catered towards your goals for this upcoming year.